Hi there, I'm Bob Anderson and I'm talking to you from the pathology suite here at Children's Memorial Hospital in Chicago. It's been my privilege over the last few summers to work here with the IDRIS archive of congenitally malformed hearts. You can tell from my accent that I'm not initially from your side of the pond. Indeed, throughout my career I worked in the United Kingdom, supported by the British Heart Foundation, and I worked with similar archives of hearts taken from children who, very sadly, died because of their congenital cardiac disease. We've learned a great amount from studying these hearts, and nowadays it is rare for children to die after surgery for their congenital cardiac disease. In many ways, this reflects the information we've garnered by studying these congenitally malformed hearts. So what we're doing in the series of videotapes that are going to follow this message to you is we're going to use these hearts to show the basic anatomy. In this first series of tapes, we're looking at a very complex malformation that is known as congenitally corrected transposition. The essence of this lesion is that the atrial chambers, the upper chambers of the heart, are joined to inappropriate ventricular chambers, so that the right atrium is joined to the ventricle that ought to be on the left side of the heart. Now, when I describe these hearts, sometimes I make little slips. So instead of saying the left ventricle, I may say the right ventricle. If I'm aware that I've done this, I correct myself, but I know that on one or two occasions I have not made the necessary correction. But if you take note of the overall context of the sequence, hopefully you will understand the anatomy I'm trying to put before you. So in this initial series of tapes, we're going to show you the anatomy of congenitally corrected transposition. We'll then be creating further series of demonstrations using the IDRIS archive held here at Children's Memorial Hospital in Chicago, so that hopefully, overall, we will be able to introduce you to the general anatomy of congenital cardiac disease.